Danielle Townsley, and I'm going to present data from the NHLBI. This is an investigator-initiated trial, a very large trial for a rare disease, 92 patients now enrolled, and since it is a late-breaking, some of the data I'm going to be presenting is actually newer to that, which is already in the press release. So this is a unique study in the sense that it is a government-funded study. It is an investigator-initiated trial being run and developed by the NIH. There is some research support in a unique cooperation through what is called a CRADA. This is a cooperative research and development agreement that the government has with industry. So this trial has received some research funding from GSK and now Novartis, who owns Eltrombopag. So Eltrombopag is a thrombopoietin receptor agonist, and it was originally developed to treat ITP and FDA approved for that purpose. It acts in a site distinct from endogenous thrombopoietin, which endogenous thrombopoietin binds to the extracellular domain of the TPO receptor to stimulate signal transduction. And Eltrombopag acts in a non-competitive way to TPO at a site distinct in the transmembrane domain of the TPO receptor. Now, the clinical applications are, as I told you, it was originally developed for ITP in 2008. It's easily administered orally once daily because the half-life is fairly decent at 30 hours. And last year, it was actually FDA approved for relabeling for refractory severe aplastic anemia, and that was primarily based on trials at my institution in which it was found that patients with refractory severe aplastic anemia could have a 40% hematologic improvement rate when given Eltrombopag as a single agent. And what's particularly unique was that we were able to identify that the drug was capable of trilineage improvements, meaning not just platelet improvement, but also neutrophil and red cell improvements. This is not entirely a surprise since we know that the TPO receptor is also on stem cells, hematopoietic stem cells. So it was therefore quite logical for us to consider combining Eltrombopag alongside the standard treatment for severe aplastic anemia, for new onset severe aplastic anemia with immunosuppressive therapy, which is horse ATG and cyclosporin. Now, the thinking was that Eltrombopag really might be able to expand the stem cell pool, increase response rates for severe aplastic anemia, accelerate count recovery, and really prevent stem cell depletion, thereby possibly even avoiding clonal progression. This current study design included 92 patients, as I told you, and all patients received standard immunosuppression with horse ATG and cyclosporin. In the first cohort, patients received Eltrombopag at a fixed dose of 150 starting day 14, and this was to sort of wait for any potential hepatotoxicity that could occur in combining it with horse ATG, and that was continued for 6 months. In the second cohort, we abbreviated the exposure of Eltrombopag to 3 months, and in the third cohort, Eltrombopag was given alongside ATG once we were comfortable that Eltrombopag and cyclosporin was not going to be an issue from any toxicity standpoint, and Eltrombopag in the third cohort was continued until 6 months. Hematologic response was assessed at 3 and 6 months, and patients were continued to be followed up over 5 years, and as is our practice at the NIH, we actually continue to follow patients beyond the 5-year mark as long as they will continue coming back to the NIH. Most of our patients continue to come back 10, 20, 30 years after receiving any treatments with us. I do want to emphasize that the primary endpoint of the trial is really complete response at 6 months. So here you can see data for all the cohorts. Most of them are all now evaluable. They all enrolled consecutively to each cohort. So cohort 3, as you can see, has most patients evaluable at 6 months, 20 patients right now. And what's striking is the overall response rate at 3 months is 81%, and the overall response rate at 6 months is 86%. Now, the complete response rate is 28% at 3 months, and at 6 months, 37%. So how does this fare with horse ATG and cyclosporin? I'm not sure how to get rid of that cursor there, sorry. Well, our historic rates of response with horse ATG cyclosporin, and as you can see, we have 388 patients to look at from prior trials, were quite different in that about 20% of an improvement in the overall response rate and the complete response rate was noticed with this combination therapy. And most notably, we are seeing that the highest response rate, an overall response rate of 92% at 3 months and an overall response rate of 95% at 6 months is really being seen in cohort 3. And also notably in cohort 3 right now, the complete response rate at 6 months is 60%. And as you can see, historically with horse ATG cyclosporin alone, that rate was 12%. In terms of adverse events, we've had actually very few significant high-grade events attributed to Eltrombopag. Really, the only notable have been 2 severe cutaneous reactions in patients which required Eltrombopag to be stopped. And other than that, there has been about a 10% rate of low-grade liver enzyme elevations. There has been no increased fibrosis on bone marrows, and there has only been 1 death on study due to a thymoma with paraneoplastic associated encephalopathy. Now, clonal evolution I've included on this slide. It's not considered an adverse event. It's really a feature that has been noted in severe aplastic anemia for many, many years. Patients, around 10 to 15% of our patients in prior trials were noted to go on to clonally evolve. At this point, we've seen 7 cases out of the 92 enrolled on study. Longer follow-up will really be needed to assess that rate in comparison with our prior trials. So in conclusion, Eltrombopag increases overall and complete hematologic response rates in treatment-naive severe aplastic anemia. The immediate introduction of Eltrombopag alongside horse ATG and cyclosporin may be optimal and is associated with, as you will see in other slides that I will show on Tuesday morning, it's also associated with increased CD34 cells, robust neutrophil and platelet count recovery, and transfusion independence within 1 to 2 months of receiving a treatment for patients who respond. As I said earlier, there really might be a longer follow-up that's required to assess the clonal evolution rate as it compares with horse ATG and cyclosporin alone. Okay.